Welcome to Talking Dentures, where Simon answers all your questions about dentures.
Yeah, okay, so the question today is from Sandra H. At what age do most people need dentures? Oh, blimey. So that's a difficult one. It's a sort of sliding scale, almost like a exponential curve, I guess. I've made dentures for children that may have been born and their teeth never grew. You know, children can have accidents, or they're overcrowding and they need dentures that are made. I've done some where they're orthodontic appliances but have teeth on them as well, braces that is. But generally, I would say most people that need dentures, so women tend to need dentures sooner than men. That's all to do with the baby making apparatus. So, you know, lack of calcium and things like that that can strengthen teeth that they're put into the baby that's gestating, and so that has a more of an effect on the female teeth, so they're more likely to need dentures sooner than a man would. But then you could say, do women look after their teeth a little bit better than men? Yes, they probably do. I think one of the biggest factors is whether somebody sees a dentist regularly or not. And I'm not saying that because I'm a dentist, because I'm not a dentist. I'm a technician. I'm the guy who puts the teeth back in. So it's very common to see people that are scared of going to see a dentist, so they don't go, and then they get a problem like an infection that's usually under the gum where you can't see it, that can then spread. Then they end up needing, when they are in pain and they start getting abscesses, so then they have to go to the dentist, and then by that point the teeth are unsavable and then they have to be taken out, and then the only real option is either implants or dentures, and quite often implants isn't an option either because the bones deteriorated because of all the infection, and so the only solution in that sort of situation is dentures. And those people probably wouldn't have needed dentures if they'd gone to the dentist and had some hygiene and got their teeth cleaned and were shown how to maybe clean their teeth a little bit better than what they were doing. But quite often what it is the plaque builds up on the teeth, and you might be brushing your teeth every day, scrubbing away, but the plaque is really hard calcified material that's laid down by the bacteria, and it will just get bigger and bigger and bigger, and it fills those gaps in between the teeth. It like clings on to the teeth, and if you've got any, you can feel it because it'll feel rough. If you're, especially on the lower teeth, behind the teeth there, you can feel it, the plaque building up, feels like rough. If you haven't got any, your teeth should feel nice, smooth and shiny, and if they don't, you've got plaque on them. Okay, so if you've got plaque on them, get to the dentist and see a hygienist, have your teeth cleaned, because what will happen is that plaque, it won't just be on the surface of the teeth, it will get down under the gum level. It starts expanding, and as it's getting under the gum level, it gets close to the bone. As it's getting closer to the bone will not tolerate any bacteria near it, so it shrinks back. As the bone shrinks back, this is when the teeth then get wobbly and will then need extracting. Some situations where you've lost a bit of bone, we can rehabilitate that with some cleaning. We agitate it, makes the gums sore, and you might have had this if you've been to the hygienist and, you know, they concentrate on an area and get it all sore and it starts bleeding and it like a bit painful. But what we're doing is we're agitating it, we're cleaning all the bacteria away, agitating it. The blood there will stimulate the growth, and sometimes we can get that bone to grow back a little bit and get the tooth to kind of attach itself back to the bone where it should be to save the tooth. I've kind of gone off topic a little bit. So what age do people usually need dentures? And I would sort of say usually for most people sort of from the age of about 50, but female maybe younger. And if you've got, you know, if you get that gum disease and it starts spreading and, you know, you get tooth loss or tooth decay, then it could be a lot sooner. So many women in their 20s that need all their teeth extracted, and through no fault of their own either. So there's nothing to be embarrassed or ashamed about, and that tooth loss and bone loss may mean that the only option is dentures. However, dentures, they don't have the same sort of stigma that they used to years ago when they weren't very good, and you get that kind of situation where teeth are taken out, you know, and they're put in the glass on the bedside cabinet. It's not like that these days. Dentures, especially if you get dentures sooner, because they're just replacing a few teeth, you know, they're so lifelike, they're so realistic that if you smiled, not even a dentist would know by just looking at you whether you've got a denture in. If you've got a really good quality denture, that is. You know, if you've paid like a few £100 and got it on the NHS, then no, it's a different story. That will, you know, that can be a little bit obvious when the denture's there, especially if it's not fitting properly, and as you're talking, it's dropping and moving around. But there is a huge difference between something that's made cheaply on the NHS to something that's made privately in you know, private practice, or by a clinical dental technician like myself, and it's made with high-end materials in the laboratory where you're paying a lot more money, but a little bit between, you know, whether you've got a Fiat Punto or a Audi R8 or something like that. So yeah, it varies widely and for all sorts of different reasons. As I say, could be 15-year-old, had an accident, knocked all your front teeth out, you need a denture. Or you could be in your 80s and you've still got most of your teeth, but you've lost a couple and you need a denture to just fill those missing gaps. All right, hope that was helpful. See you in the next one.
Thanks for watching, and don't forget to send us your questions. There's a link in the description below. Bye!